Supramaximal stimulation in objective neuromuscular monitoring. Objective neuromuscular monitoring is a process whereby the intensity of a resulting muscle contraction is monitored with an electrical nerve stimulus to determine the efficiency of a neuromuscular blocking agent, or NMBA. In order to achieve a reliable result when doing objective neuromuscular monitoring, two primary pathways should be considered. The first pathway extends from the placement of the cathode or negative black electrode to where the intensity of the electric field creates an action potential, leading to a resulting muscle contraction. We will refer to this as the stimulating pathway. The second pathway considers the inhibitory influence of the injected muscle relaxant on the neuromuscular junction. Both of these pathways can influence the strength of the resulting muscle contraction. In order to reliably make an assessment of the efficacy of the muscle relaxant, we need to create an environment where the first pathway is constant and repeatable. This is achieved by applying a supramaximal current to the nerve. What is a supramaximal current? Supramaximal current is best explained in the context of submaximal and maximal stimulation. A submaximal stimulation is a stimulus resulting from a current setting which does not result in the recruitment of all relevant muscle fibers. In contrast, a maximal stimulation is a stimulus resulting from a current setting which does result in the recruitment of all relevant muscle fibers, thus eliciting a contraction at maximum strength. Supramaximal stimulation is a current setting which achieves a maximal stimulation and is further increased by an additional 10 to 20% in order to compensate for any intraoperative factors that could potentially affect the stimulation intensity, such as impedance changes affecting the electrode-to-skin interface. These factors include skin temperature, drug-induced changes, or movement of the electrode due to movement of the patient. Clinical studies have confirmed that when a submaximal current is applied, then both the pathways remain variable, and one cannot make a reliable assessment of the efficacy of the muscle relaxant. We therefore recommend the use of a supramaximal current during objective neuromuscular monitoring. Please note, since supramaximal nerve stimulation is usually quite painful, it should only be performed on an anesthetized patient. Implementing the Stimpod NMS 450 for supramaximal stimulation. Some monitors provide a calibration function which attempts to find the optimal supramaximal setting. However, this can often be time-consuming and inadequate. In order to be assured that supramaximal stimulation is achievable with the maximum current output of the stimulator, one needs to ensure optimal electrode placement. More specifically, the cathode or black electrode needs to be placed on the most superficial aspect of the chosen nerve site. In clinical practice, an anatomical estimation is usually made about the most superficial position of the targeted nerve. This, however, does not account for any anatomical deviations which could affect the variability in the pathway. In order to make locating of the optimal electrode placement with the Stimpod practical in a clinical setting, we recommend using the supplied nerve mapping pen in order to locate the most superficial aspect of the targeted nerve. If the electrode placement is optimal, assumptions can be made regarding the current intensity required to qualify as a supramaximal stimulation. For further demonstration and use of the nerve mapping pen for optimal electrode placement, please view the following videos by Zavant. Trainer for monitoring of the ulnar nerve, trainer for monitoring of the posterior tibial nerve, and trainer for monitoring of the facial nerves. Thank you for watching this instructional video on supramaximal stimulation, and we hope you found this video informative. For any further information on our products or neuromuscular monitoring, please visit our website at www.zavant.com.